Hey, I already got beat up this morning.
By what?
I can't report.
You can't. Well, get us started, man.
Let's go. Another great episode of Staying in Trouble with your hosts Eric Humes and Adam Short. We have a great topic to talk about tonight. One of my close friends, Dr. Chad Hanson, is here tonight. I'm going to ask him to introduce himself. Everyone looks up to him, except for when he's on the basketball court. Chad, tell us a little bit about yourself.
Thanks, Eric and Adam. So I've been in practice here in Las Vegas for 10 years. I do sports medicine, orthopedic surgery, and I'm a partner in Desert Orthopedic Center. And we've got 4 practices or 4 locations here in Las Vegas, and we provide the full breadth of services. And my focus specifically is on sports medicine and trying to keep active people active.
I love it.
Yeah.
I love it. So today we want to talk about stem cell therapy. For those that don't know, and maybe have just heard the seen the hot headline, or think about it in its futuristic application, or maybe they've seen like, oh, FDA doesn't approve this or FDA doesn't do that. Give us a little rundown, a little quick synopsis. What is stem cell therapy? Is it going to make me younger? Is it going to give me more hair? Like what? How can it help me today?
There is not medicine out there that can help that.
Well, I think first off, when you hear the media talk about stem cell therapy, that can mean so many different things.
Okay.
And so it's important to understand that what we call in our office, we talk about biologic treatment.
Oh, okay.
It's kind of a misnomer to say stem cells, because there's very few applications where you're actually using stem cells, but we are using biologic methods, whether it be from your blood or from your bone marrow or from a donated tissue, to try to help in what we call regenerative medicine. And the key being is, I'm an orthopedic surgeon, I love to operate, but there's a variety of conditions out there that aren't quite bad enough for surgery, but they're not good enough that people are happy with how it feels. And so there's that kind of chasm in between where they want something done. And when they've failed other modalities such as therapy or bracing or even regular steroid injections, then you get into this question of, well, do we operate on this, or is it something that we think we can get better in other ways? And this is the niche that the biologic injections have really taken hold. And so I think that's kind of the first takeaway is, again, while it's easy to say we're talking about stem cell therapy, we're really looking at a biologic way of using some type of fluid, whether it's blood or plasma or amniotic cells, to try to help tissues heal in a non-surgical, non-invasive way.
And so this is mainly for your joints. I'm assuming that's probably the number one injury amongst any athlete or any active person is joint pain, joint problems.
Yeah, I think you've got 2 main categories. One would be joints like knee arthritis, and the other would be tendon problems, which the common ones out there would be like tennis elbow or patellar tendonitis or Achilles tendonitis or rotator cuff tendonitis. Those are probably the most common things that we see. But as you know, there's applications for these biologics across the board, and there's plastic surgeons using them, and there's estheticians using PRP. And so it has become very popularized, and I think there's often a lack of understanding with what you're actually getting when you're paying for quote-unquote stem cells.
What's a PRP?
Great question. So PRP is platelet-rich plasma.
You just buy that right off the shelf? You just get that at the local biotech.
Well, we try to stay clear of the biohazard area. Essentially, platelet-rich plasma is a process where you draw someone's blood, and then you take that blood and you spin it in a centrifuge. And there's a variety of companies out there and a variety of settings and how long it takes or how quick it is. And you essentially separate out the different components of blood. And when you get that plasma, or that platelet-rich plasma, so PRP, that's ultimately the fluid that you're injecting back into the damaged tissue or joint.
Okay. And that helps it, like you said, regenerate? And is it your own blood, or are you getting someone else's blood, and what are they injecting? I mean, it seems like if they take the blood out, are you just taking like bad blood away from it or bad parts of it?
No, so it comes from yourself. So we in the office, when somebody comes in for a PRP injection, we draw their blood, and this is healthy blood just from the vein, and then we separate out the different parts of the blood via centrifuge.
Okay.
And then we draw off that plasma, which ends up being like a clear or golden fluid.
Oh, I always thought of plasma as being like super dense, like almost like a gel of like red. In my mind, that's what I was imagined. I had no idea.
Yeah, so the red stays in the vial.
Okay.
You draw off the plasma, and then that's what you're ultimately injecting into the joints. And if you look under the microscope and break down, okay, what are we actually getting from platelet-rich plasma? By and large, it is growth factors.
Mm.
So again, people talk about stem cell therapy. If you're talking about PRP, that's actually growth factors. Now, there's a lot of literature out there for different joints that show efficacy and that it can work. And while it's not 100% of the time, for someone who's certainly trying their hardest to avoid surgery, there's a lot of conditions where PRP is a very good option to, again, you're not risking infection because they're using their own tissue to try to help introduce growth factors, stimulate healing in that area.
How soon how soon would someone like contact you? Like, Adam and I are getting a little bit saltier, right? On the head is what was determined. A friend of mine said, I said, you're getting a lot of white there. He's like, Eric, it's salty. Getting a little bit more salt and pepper. We're getting a little bit saltier, so I would think that like our demographic is probably in your office every day thinking, like, is this an opportunity that I can make me, I don't want to say younger, but like I said, more agile, maybe make